Hello, my name is Bob Sherrar. I am a physician and epidemiologist who has spent a lifetime working on public health issues. I am the current chair of the section on public health and preventive medicine for the College of Physicians of Philadelphia. I would like to welcome you to this webinar series on climate change and health in Philadelphia. I would also like to thank Dr. Marilyn Howarth and the members of the academic public health programs who put this wonderful series of presentations together. Climate change is one of the most important public health issues facing our worldwide community. This webinar series was put together because the public health community must know and understand the huge impact that climate change will have on human societies throughout the world. And we must work together to lessen its impact. Now, Philadelphia is blessed with a wealth of public health talent. There are 8 schools in the Philadelphia metropolitan area that offer training in public health and hundreds of students working on various public health degrees. The purpose of the section on public health and preventive medicine is to bring this vast public health community together to address issues facing our communities. Any person interested in public health may join the section, where they can network with the public health leaders of our community. You do not have to be a member of the College of Physicians. Student memberships are free. To learn more about the section, go to the college's website and read about the various activities that we sponsor. Now, sit back and relax and learn from these wonderful webinars. Thank you.
Hello, and welcome to this webinar on the vulnerabilities of workers to the risks of climate change. My name is Jerry Fagliano. I'm a clinical professor in the Dornsife School of Public Health at Drexel University and an environmental epidemiologist by training. I worked for a state health department in environmental and occupational health for 30 years before spending the last 10 years as a professor at Drexel. One of the things I've focused on at Drexel is on integrating climate change science and practice into the core public health curriculum. This webinar will cover the following topics. We'll start with an introduction to the special vulnerabilities of workers. How does climate change threaten their health? What working populations are at greatest risk, and what makes them so? We'll also discuss ways that workers can be protected, with an emphasis on outdoor workers and those committed to responding and helping society recover from climate change-related disasters. Here are the learning objectives of this webinar. I hope you'll gain a deeper understanding of and be able to describe the reasons that workers are at increased risk of climate change, that you'll be able to discuss the specific ways in which outdoor workers and emergency responders and recovery workers are put at increased risk, and how these working populations can be protected, and that you'll be able to point to examples of organizations and institutions that are working on these important protective efforts. Let's start with a discussion about how climate change threatens the health of workers. Here, I've listed some of the hazards associated with climate change. There are, of course, the direct effects on health that are caused by exposure to extremely hot conditions, or to the immediate effects of extreme storms and flooding events. Climate changes affect worker health in a variety of other direct and indirect ways as well. For example, a hotter atmosphere can lead to increased formation of some air pollutants, such as ozone, to which outdoor workers may be exposed. Wildfires pose direct hazards to firefighters and other responders, of course, but can also produce widespread particulate air pollution far from the fires themselves, again putting outdoor workers at risk. Other climate change-related environmental factors are noted on the slide as well. While all of these are, of course, important, My focus in this webinar is primarily on the effects listed in the first bullet. I'd like to spend a few minutes thinking about what makes people, including workers, vulnerable to climate-related changes in the environment. The first consideration is that not everyone will experience climate change the same way. Not only do people experience different environments in their daily lives, but different people may respond differently to the same environment. Nor do people have the same capacities to control or alter or get away from climate change-related hazards in their environments. These observations lead to the development of an idea that vulnerability to climate change can be thought of as having three distinct components. One's vulnerability to be harmed by climate change is determined by, first, the degree to which one is exposed to a hazardous environmental condition, whether it is extreme heat, rising sea level, extreme rainfall, or drinking water contamination, to name a few. Second, even under the same exposure conditions, different people may react or respond differently based on their individual characteristics and sensitivities. For example, an older person may be more sensitive to the effects of hot environments, or someone with asthma may be more sensitive to a given level of air pollution. And third, not everyone has the same capacity or ability to control their environmental conditions or avoid hazards. For example, because they can't afford access to air conditioning or they have no access to transportation to get away from a hazardous situation. This diagram, which was developed by the US National Climate Assessment, conveys these three dimensions of vulnerability. It shows that the likelihood of any individual or community of people will be affected depends on each of these components. And importantly, an individual or community may be vulnerable or placed at increased risk because of the way these components combine in their individual experience. It's useful to consider these components of vulnerability when thinking about workers. Many workers are vulnerable due to increased exposure to climate-related hazards because of the nature of their work and where they perform their work functions. For example, due to the nature of their occupations, outdoor workers are more likely to experience periods of time in extremely hot environments. Think about outdoor construction workers on a summer day or firefighters battling a wildfire. Such workers also may have limited ability to control their working conditions because of the nature of their work and or because of limited power in their workplace. We'll explore these issues in upcoming segments of the webinar. Next in the webinar, we'll take a closer look at the vulnerabilities of outdoor workers and how to protect them from climate-related harm. In this segment of the webinar, I will address protecting outdoor workers, in particular from the climate change hazard of extreme heat. I'll start by describing how outdoor workers are particularly vulnerable to climate change, then talk about how they might be protected. I'll give an overview of the powers that governments have to protect workers and the limitations of those powers as they are applied, and then discuss some examples of efforts to advocate for outdoor workers' health. We can use the components of vulnerability framework that I introduced earlier in the webinar to think through the ways in which outdoor workers may be susceptible to climate change, particularly to episodes of extreme heat. Outdoor workers are most obviously put at increased risk because they are more likely to be exposed to extreme heat conditions due to the nature of their work outside, often engaged in high levels of physical activity during the times of year when extreme heat is most intense and most frequent. Think about landscapers tending yards and gardens, or farm workers picking crops in the heat of summer, or construction workers working on a roof in the direct sun. Some outdoor workers may be more sensitive than others due to personal demographic characteristics such as age, medical condition, or fitness level. Lack of access to sufficient drinking water can result in dehydration and increased sensitivity to heat-related illness. In addition, high heat exposure early in the season may result in worse effects than later in the season when workers have been able to acclimate to such conditions. Outdoor workers may be more vulnerable since their control over their working conditions may be limited by low job autonomy in general, that is, lack of control over their work schedules or conditions, and potential threats to their employment security if they are unable to work due to heat-related illness. So how can we develop strategies to protect workers from heat-related illness? Let me start with a brief discussion of the industrial hygiene concept of the hierarchy of controls. This idea, as shown in the diagram by the National Institute for Occupational Safety and Health, or NIOSH, shows different strategies in priority or preferred order from top to bottom. When possible, workplace hazards should be avoided altogether by eliminating the hazard or substituting it away. These strategies, unfortunately, are unlikely to be available for the control of exposure to heat among outdoor workers. That leaves engineering and administrative controls, that is, changing the degree to which workers are exposed by changing work conditions and how people work. I will discuss these more in a moment. The remaining strategy, when other strategies are unavailable or impractical, is providing workers with personal protective equipment to shield them from the hazard. Engineering controls and administrative controls are the most practical strategies to protect outdoor workers from heat. Engineering controls include the provision of shelters and shaded areas, fans or other ventilation methods, and provision of plentiful, cooled, safe drinking water to avoid dehydration. These are coupled with administrative controls, such as adjusted work hours to avoid the hottest periods of the day, scheduled or as-needed break times in shaded or cooled spaces, and modifications to work pace requirements. Personal protective equipment in the form of cooling clothing can be effective under the right circumstances. Such clothing may be made of fabrics that wick moisture or conduct heat away from the skin, or even incorporate ice packs or other coolants. In addition, there is a need for training of employers and employees to increase awareness of the dangers of extreme heat and the methods to avoid overexposure. Training should also include awareness of the early signs and symptoms of heat stress. Workplaces need to develop response plans in the event of extreme heat or predicted extreme heat that may be triggered by accurate local forecasts on expected conditions. And they should be able to provide prompt first aid and other needed medical attention on site. Let me turn now to the laws and regulations that are intended to protect workers from hazards in general and specifically to address extreme heat. The Occupational Safety and Health Act of 1970 establishes the legal basis for worker protection in the United States. The purpose of the Occupational Safety and Health Act was, quote, to assure safe and healthful working conditions for working men and women. The Act applies to all private sector workers in the United States. The Occupational Safety and Health Act declares that each employer shall furnish to each of his employees employment and a place of employment which are free from recognized hazards. This is known as the General Duty Clause. The Act established the Occupational Safety and Health Administration, OSHA, to enforce the Act and to develop occupational safety and health standards to apply to many or most workplaces, such as standards on sanitation or ventilation, noise control, personal protective equipment, as well as standards related to specific toxic threats such as lead or benzene or asbestos. There is at present no OSHA standard to protect workers from extreme heat in the workplace, resulting in a reliance on the general duty clause for any protections that may exist. As noted, the Occupational Safety and Health Act generally preempts state worker protection laws unless a state has an OSHA-approved state plan. As we'll see, some states with an approved plan have taken steps to establish a standard for heat. To address the gap in federal protection from extreme heat in the workplace, the National Institute for Occupational Safety and Health, NIOSH, issued a recommended heat standard in 2016 for consideration by OSHA. I want to note that NIOSH, which is also established by the Occupational Safety and Health Act, and until recently was a component of the Centers for Disease Control and Prevention, or CDC, is a non-regulatory federal agency that, among other things, advises OSHA on the development of worker protection standards. NIOSH's recommended heat standard recommends workplace heat limits and temperature triggers for action, medical monitoring and surveillance of workers for heat-related exposure and illness, engineering and administrative controls, personal protection, and training along the lines of the strategies we've previously reviewed. 8 years after NIOSH produced its recommendations for a heat standard, OSHA did formally propose a national heat standard in August of 2024. This standard requires employers whose workers may encounter extreme heat to develop and implement heat injury and illness prevention plans. This standard closely follows the recommendations made by NIOSH in 2016. Public comments on the proposal, over 20,000 were submitted, were due in January 2025, and OSHA held public hearings in June and July of 2025. It is in doubt whether the standard will be finalized by the current federal administration, given its anti-regulatory stance, but that remains to be seen. Meanwhile, as alluded to earlier, the state of California, under its state plan, has established an extreme heat standard for workers in that state. This comprehensive standard requires employers to write heat illness prevention plans, provide training to employees and managers, and includes a 14-day period for acclimatization to heat for new employees. Specific worker protection measures, chiefly engineering and administrative controls, are required based on ambient temperature triggers. Just a handful of other states also have heat standards that either are established or are in development. Other states, unfortunately, have taken very different approaches regarding the protection of workers from extreme heat. Florida and Texas not only do not have state-level regulations to protect workers from extreme heat, despite the frequency of high heat in those states, but both have passed laws that prohibit local governments, that is, cities, from passing ordinances designed to protect outdoor workers in their cities. For example, in 2024, when Miami-Dade County proposed a local law requiring employers to provide water, shade, and break time to outdoor workers when the heat index exceeded 95 degrees Fahrenheit, the Florida legislature passed a law invalidating that county's action. Similarly, the state of Texas banned local regulations in response to attempts by Austin and Dallas to protect workers in those cities. To close this segment of the webinar, I want to briefly mention the efforts of non-governmental organizations whose mission is to protect construction and other outdoor workers in general and including protection from extreme heat and other hazards. The Center for Construction Research and Training, for example, is a nonprofit organization, quote, dedicated to reducing injuries, illnesses, and fatalities in the U.S. construction industry. The center conducts research and provides training to construction workers and employers. The infographic indicates the disproportionate impact on construction workers of fatal heat-related illness. Construction workers account for about 7% of the overall workforce in the United States, yet 38% of heat-related deaths at work happen among construction workers. The center produced a checklist for employers considering a heat illness prevention program, as shown on the right. This slide lists some of the advocacy organizations that support the health, well-being, and rights of farm workers in the Mid-Atlantic region. These organizations are supported by coalition partners from government agencies and other advocates for health, environmental, and human rights. More information on their missions and activities is available on their websites. In the last segment of the webinar, I'll discuss protecting emergency responders and recovery workers from injury, and then end with some concluding thoughts. Now, in this part of the webinar, we'll talk about protecting emergency responders and recovery workers from injuries. By the nature of their work, these working people are put in harm's way as climate change-related disasters occur more frequently and sometimes with greater intensity, including extreme storms and flooding events and major wildfires. I'll start this segment by considering the ways in which emergency responders and recovery workers may be put at greater risk of injury and how they might be protected. While my focus will be on injuries, other health risks are important, including short and long-term consequences of exposure, such as to toxins or microbiological hazards in air and water, as well as the mental health effects related to the stresses these workers endure while doing their jobs. I'll end with a short wrap-up with key takeaways from this series on vulnerabilities of workers to the risks of climate change. Before going on, I think it would be useful to better define the occupations that are the focus of this segment of the webinar. When we think of emergency responders, those whose job responsibility includes being on scene when a disastrous event occurs, we immediately think of firefighters, emergency medical technicians or EMTs, police, and search and rescue teams, for example. Taking a somewhat broader perspective, one might also include dispatchers, hazmat teams, public works personnel, such as electrical utility workers or water and wastewater treatment workers. Emergency shelter attendants and managers might be included as well. The risks of physical injury may differ among these groups, from extremely high to very low. However, risks such as mental health impacts may be high among all of these occupations. In the days, weeks, and months following a disastrous event like an extreme storm and flood or a major wildfire, there is a need to bring a community back to its pre-disaster state of functioning. Disaster recovery workers include people such as electricity line workers, arborists and other tree workers, landscapers, and environmental cleanup workers. These occupations are typically engaged in restoring electricity or making repairs to other public infrastructure like roads or water and sewage treatment. The need for such tasks may be particularly acute and can be particularly dangerous shortly after the disaster. In addition, many other occupations may be engaged with the work to bring a community back to a functioning condition in the aftermath of a disaster. Workers such as environmental cleanup technicians, building contractors, truck and forklift drivers, and healthcare workers may have increased workloads and higher risk of injuries related to their occupations during the recovery period after a disaster. So, how are emergency responders and recovery workers vulnerable during disaster response and recovery? And what role does climate change play in the degree of risk they experience? The nature of their work includes the potential for exposure to a long list of hazardous situations. My focus will be on injuries, but I want to acknowledge a variety of health hazards here, which are also important. These include the short and long-term health consequences, such as to toxins or microbiological hazards, in air and water, as well as mental health effects related to these stresses that these workers endure while doing their jobs, which I spoke of earlier. Emergency workers responding to extreme storm events and associated flooding are put in harm's way in multiple ways. There is the potential for physical injury from being struck by objects blown by high winds or carried by floodwaters during storms and search and rescue operations, and physical injury from interpersonal violence. There is, of course, the risk of drowning. There are electrocution risks due to downed and energized power lines, and there are potential microbiological or chemical hazards related to contact with contaminated floodwaters. Fighting wildfires poses numerous risks as well, including, of course, the potential for severe burns and inhalation of smoke. I'll discuss wildfire firefighting and the injury hazards related to tree work during recovery from extreme storms shortly, but let me return to the question about the role of climate change. In all these situations, climate change acts as a kind of risk multiplier. Most, if not all, of the hazards I've just discussed are conditions that may be inherent in these jobs, but a changing climate can make disastrous events more frequent, more severe, and longer lasting. Not only does this increase the burden of risk on emergency response and recovery workers, but the potential for multiple and overlapping events in time and space can stress society's systems that may be in place to respond adequately, care for disaster victims, and ultimately to recover. So this brings to the fore another important concern, and that is the impact on mental health of emergency responders and recovery workers, and to all the associated occupations and professions that I noted while defining these groups. Response and recovery workers may be threatened by or experience physical dangers, which can lead to post-traumatic mental stress. In addition, there is a need to consider secondary traumatic stress, or the distress that is felt by people who are exposed to the traumatic experiences of others. How might emergency response and recovery workers be protected from climate change-related risks? Well, here are some ways. Accurate forecasting of potentially disastrous events is needed to provide responders with adequate time to anticipate and prepare. For example, as an extreme storm event unfolds, reliable systems to monitor conditions like wind speed, rainfall, river levels are needed to keep responders and the population safe. Engineering controls may include the use of robotics or remote sensing to gather information about unfolding events to complement the deployment of responders in the field. Similarly, engineering controls may include equipment and vehicles that are capable of withstanding the extreme conditions that may occur during a disaster. Other strategies may include rest periods and breaks away from hazardous conditions, and the use of personal protective equipment, such as appropriate turnout gear for the hazards to be encountered. And of course, safety protocols and associated training are essential to ensure that responders and recovery workers can protect themselves and limit risks during their work. Let's look at a couple of examples to illustrate the risks to emergency response and recovery workers. The first example is the risk of severe injury and death from cutting and removing trees during and in the aftermath of extreme storms. Fallen trees may need to be removed, sometimes under intense time pressure and under poor visibility conditions, to address potential fire or electrocution hazards, to restore electrical power, or to clear roadways or railways. Fallen trees may be unstable, and trees may be under powerful compression and tension forces, and these forces may be unleashed with serious and sometimes deadly effect when trees are cut, moved, or removed. Severe injuries may also result from falling limbs, cutting tools, vehicles, and electric shock from transmission wires. Injuries can occur to all parts of the body, including the head, torso, and limbs, and if unprotected, eye injuries may also occur, for example, from sawing debris. from sawing debris. Superstorm Sandy made landfall on the New Jersey coast on October 29, 2012. The storm caused extensive damage due to high winds, floods, and coastal storm surge, as many of you may remember. Millions of people in the region were without electricity for varying periods of time. Some hospitals and long-term care facilities had to be evacuated, and even more facilities lost power. Over 125 shelters were established in New Jersey to provide safety for over 7,000 people. A variety of public health consequences occurred, including drowning, injuries, carbon monoxide poisoning, respiratory symptoms, and hypothermia. Public health scientists at the Rutgers School of Public Health and the New Jersey Department of Health sought to document the extent of injuries specifically related to tree work in the response to and recovery from Superstorm Sandy in New Jersey. This study examined emergency department and hospitalization data during and in the aftermath of the storm. The scientists identified over 700 tree-related injuries due to being struck by trees or branches, by falls, and by cutting or other machinery. There were 3 tree work-related deaths during the response and recovery periods. A second example is that of respiratory protection among wildfire firefighters. Smoke inhalation can result in serious and potentially fatal respiratory effects. Effects may be felt immediately, of course, but there is also concern about the potential for long-term effects that may not arise for years or decades following acute or repeated acute exposures to wildfire smoke, including chronic respiratory diseases and cancers. Until recently, and unlike the practice in firefighting generally, wildfire firefighters were barred from using effective respiratory protection, specifically respirators, by the U.S. Forest Service. The reasons given for this ban on respirator use was that respirators were thought to increase heat stress in firefighters, cause discomfort, and interfere with firefighters' ability to work effectively or efficiently. However, over time, pressure has grown from wildland firefighter organizations, their advocates, and state and federal legislators, based on growing awareness of and concern for the potential long-term risks posed by smoke inhalation. Finally, in September 2025, the U.S. Forest Service reversed its long-held position, and respirator use is now encouraged among wildfire firefighters. Numerous governmental and non-governmental organizations support the work of disaster response and recovery workers. I've listed just a few among these many fine organizations. For more information on the missions and programs of these associations and intergovernmental groups, please visit their websites. I'd like to conclude with some key takeaways from this webinar on vulnerabilities of workers to the risks of climate change. I hope you've come away with a better understanding of the ways that workers may be at increased risk by thinking about the components of vulnerability. In what ways do some working populations experience greater exposure to climate change-related hazards, like hotter temperatures or extreme storms? How might some workers be more vulnerable because of their age or medical conditions or other personal characteristics? And how might some workers be more vulnerable because they have little control over the circumstances of their work and limited rights or power to protect themselves? In this webinar, I've focused on 2 broad categories of particularly vulnerable workers: those who work outside, like many construction workers or farm workers, landscape workers, and those whose job it is to respond to disaster emergencies and to work toward the recovery of communities in the aftermath of these disasters. I hope you've gained better understanding of the specific ways that these 2 categories of workers face climate-related risks and what can be done to protect them. In the US, the principal responsibility for protecting worker health and safety lies with the federal government, specifically the Occupational Safety and Health Administration, OSHA, with surveillance and scientific support from the National Institute for Occupational Safety and Health, or NIOSH. As I record this webinar in the fall of 2025, the ability of both of these federal entities to carry out their mandates to protect workers has been curtailed, whether risks are from climate change or more generally. While some states have OSHA-approved state plans and therefore have capacity to protect some workers in their jurisdictions, most states and localities do not. The burden of advocating for workers therefore falls more heavily than ever on worker groups, professional associations, and non-governmental organizations, as well as to those working to limit climate change in the first place. I appreciate your time. Thank you for watching this webinar.
I would like to acknowledge Adrian Wood, who edited and produced the webinars, and all of the webinar organizers shown on this slide, who curated webinars on a variety of climate change and health topics. We invite you to follow this QR code to the College of Physicians YouTube page, where you can access the webinar series. The QR code on the bottom right will take you to the section on public health and preventive medicine. We hope you will consider joining this section to learn more about public health and activities to improve it in the Philadelphia region. Thank you for your interest in our webinar series on climate change and health in Philadelphia.